The camera here? Okay, right. So this is the inguinal ligament, and that's your front of the thigh here, right? And you see the nerve of the anterior compartment is the femoral nerve, which is this one.
This femoral nerve.
Yeah. So the gap below the inguinal ligament gives passage to muscle iliacus, psoas major, femoral nerve, femoral artery, femoral vein. They'll become external iliac vein, external iliac artery, and so on. Right. So that is the femoral nerve, and you can see there are muscles from here. This is your pectineus, right? Coming from the pubis bone, pecten of pubis, small muscle, this is pectineus. Then this is psoas major. This is your iliacus, right? And there should be one very large muscle sartorius like this, which is attached at the anterior superior iliac spine. So these are the fibers of the sartorius going there, okay? And then you are having this muscle, the rectus femoris, making quadratus, vastus medialis, vastus lateralis, and underneath is vastus intermedius here, right? And then you have a small muscle here from the anterior superior iliac spine and anterior border of the ilium. This is the tensor fasciae lati. Tensor fasciae lati, which inserts in the fascia lata of the thigh to make this iliotibial tract. Okay? And posteriorly, this receives fibers of the gluteus maximus. So the deep fascia gets a maximum traction here and becomes very tough. It's very tough laterally as compared to the other sides. Okay. So this is the frame of the muscles. And you are having femoral nerve, which will supply all these muscles. But the difference is that the pectineus is having double nerve supply, because its position is and function is of two types. It is flexor as well as adductor. So it is supplied by femoral nerve as well as obturator nerve. See, obturator is nerve of the adductor compartment. Femoral is the nerve of the flexor compartment. So it is having dual nerve supply. Otherwise, all the other muscles are supplied by the femoral nerve. Okay. So femoral nerve gives a cutaneous branch known as the saphenous nerve, which runs in the adductor canal. No, it's the femoral artery here. This is the profunda brachiae, profunda femoris artery, right? This is the femoral nerve, and then you are having subsartorial canal just below the here, above a hand's breadth. Here you are having adductor canal here, or subsartorial canal, and here you would expect the saphenous nerve, which is here, this one. It's a very long cutaneous nerve. It will continue on the medial side and will supply up to here. Medial side of the foot, medial side of the leg, medial side of the knee. It's a very long cutaneous nerve. This nerve must be seen, and it is the content of the subsartorial canal, which contains femoral artery, saphenous nerve, and nerve to vastus medialis. This one. These are the contents of the subsartorial canal. So you are having all the muscular branches of the femoral nerve, and if you take any muscle, you will find this nerve will supply the muscle. These are broken like this. Similarly, when you lift this muscle, you would expect branches going into it. Similarly, branches going into this. Similarly, branches going into this and this. Okay. The psoas major above is supplied by the lumbar plexus. That is difference. Supplied at the top.
This is
Psoas major. This is iliacus, and both of these muscles unite to form iliopsoas tendon, and that tendon is inserted on the lesser trochanter. So you see, it's here. So this will go and be attached here, the lesser trochanter. So this is femoral artery. This is profunda brachiae, profunda femoris artery. This one. This is the femoral nerve and its muscular branches. muscles are pectineus, psoas major, iliacus, tensor fasciolati, rectus femoris, vastus medialis, vastus intermedius, vastus lateralis. Okay, this is flexor compartment.
Flexor of the thigh.
Flexor.
Alexis of the.
When you say flexor compartment, the joint in your mind should not be this. The joint is this. These muscles cross the knee joint and then they
Extend them.
they extend. Sorry, I am using word flexor for long, which is totally wrong. I'm sorry. Delete that item from here. Delete this video. Okay. Flexor compartment is at the back. Big sorry. This is the extensor compartment. So nerve of the extensor compartment or anterior compartment. Flexor is here in the arm. Here is the extensor. So at the back is flexor. So there's a big mistake. So this is extensor compartment and nerve is femoral nerve. Then this is adductor compartment, nerve is obturator nerve, and then the flexor compartment, then the nerve is the sciatic nerve. Okay. So yeah, medial compartment is this one. Okay. If you go, there are 5 muscles in it. Okay. In the medial compartment, out of these 5 muscles, 3 are big and known as adductors. Adductor longus is the first, adductor brevis is the next, and adductor magnus is the next. They are placed here layer by layer. So you can see this is the, if you pass like this, first is adductor longus, then behind this is adductor brevis, behind this is adductor magnus. Okay, thick, very large muscle. This is adductor magnus. Okay, longus, brevis in between, and then magnus. But if you move from medial side, then first muscle you touch is gracilis. This was your sartorius, right? So this gracilis was also adductor muscle. So adductor longus 1, adductor brevis 2, adductor magnus 3, gracilis 4, and 5th is this one, pectineus. Okay, now all of these will be supplied by obturator nerve. Okay,
Sure.
but yeah, obturator nerve, but the pectineus will have double supply. It will also be supplied with the femoral, and at the same time the adductor magnus will also be having double supply. Why? Because it is in between flexor compartment behind and extensor compartment anteriorly. Oh, okay. Itself it is in the adductor. So of course it will be supplied by obturator, but it will also be supplied by the tibial part of the sciatic nerve. So in the adductor compartment there are 2 muscles with double nerve supply. One is pectineus supplied by femoral and obturator. Other is adductor magnus supplied by obturator and tibial nerve. Okay. So this is right. Okay. So this was your adductor compartment, and in the adductor compartment, adductor magnus is very important.
What is
Your
longus?
adductor longus is the first one. Close your eyes and drop your finger. Okay. Adductor longus. Okay. This is adductor longus. These are layer by layer. This is longus. This is brevis, and this is magnus. So you first is adductor longus. Close your eyes, drop your hand.
Deep to it.
Deep to it is smaller, coming like this. I can show you few fibers. This could be the adductor. Yeah, this is the lower border of adductor brevis. Okay, so longus above, then brevis below, and then a very thick big muscle is the magnus, adductor magnus. Okay, which will have an opening in it where the femoral artery will enter and come out here as an popliteal artery. Adductor magnus has got openings in it. 4 openings. Last opening gives passage to the femoral artery. Remaining are above progressively which gives to vessels known as the perforating arteries. First perforator, second perforator, third perforator. Fourth will be the artery itself, or artery itself. So there are four openings in the adductor magnus. It's very important muscle. Right. Okay. Hamstrings are very simple. There are four muscles, four hamstring muscles. But on the lateral side, the two are united to make one. So, which is the lateral side here, and which is the medial side? This is the lateral. This is the medial. Okay. So this is the region back of the knee, which is known as ham or popples. Ham. This region is known as ham, isn't it? Ham or popples. And these muscles make their tendons, which run like a string, and reach this region known as ham. That's why these muscles are also known as hamstring muscles. Hamstring muscles. Okay, so four in number. Laterally, you can see this is the biceps femoris. Okay, which is having two heads, and so two heads unite to make one muscle. So laterally only one muscle. Okay, because both the heads are united. Medially you are having two muscles. One is half muscle and half long tendon. So this is known as semitendinosus. The other muscle is half muscle on this side completely from top to bottom, while the half is like a membrane from top to bottom vertically. So vertically this is half muscle and half membrane. So this is known as semimembranosus, and this is known as semitendinosus. So total muscles are again three, because laterally two heads of the biceps fuse. So biceps, and this is your semitendinosus, semimembranosus, and see they diverge like this, and below the two heads of the gastrocnemius muscle, the lateral head and medial head, they make a diamond shaped space. Okay, a diamond shaped fossa. This is known as popliteal fossa. This region is ham or popples, so the fossa is known as popliteal fossa. Right? Artery will be known as popliteal artery. Lymph nodes will be known as popliteal lymph nodes. Vein will be known as popliteal vein. Right? And you will see that these muscles are supplied by the sciatic nerve, branches of the sciatic nerve. Lateral part muscles are, I believe, from the common peroneal. Medial part muscle by the tibial component of the common peroneal.
Nerve divides into
Into two. You see the sciatic nerve. Sciatic nerve divides into two. Laterally is common peroneal, medially it's tibial. Usually the division occurs hand's breadth above the popliteal fossa here. This is the most common, but sometimes it divides earlier, like in this. Sometimes it divides in gluteal region. Sometimes in some persons it even divides in the pelvis. Okay, so it is variable, but usually it's hand's breadth where this is dividing. This it divides into two branches. One is known as common peroneal nerve, which is also known as lateral fibular nerve, and other goes straight down on the tibial side. So this is known as tibial nerve. Two branches, common peroneal and tibial. This common peroneal will again divide at the head of the fibula, just below the head of the fibula, into two branches. Superficial peroneal nerve to supply the peroneal compartment, and deep peroneal nerve to supply the anteriorly located extensor compartment. So superficial peroneal and deep peroneal. While tibial will stay as nerve of the flexor compartment. When the leg you are having three compartments. Three compartments here in the thigh, extensor anteriorly, flexor behind, and adductor medially. Three compartments here. Laterally the peroneal compartment, posteriorly the flexor compartment, anteriorly the extensor compartment. The nerve of the peroneal or lateral compartment is superficial peroneal nerve. The nerve of the anterior or extensor compartment is deep peroneal nerve, and the nerve of the posterior compartment is the tibial nerve. So you can see all the nerves practically going to their respective compartment, going to their respective destination of supply. Fine. So this is how it's. When you see the muscle, you must note number of joints crossed by the muscle. You should note two things. One, number of joints crossed, because whichever joint is crossed will be that muscle will be acting on that joint. The action of the muscle will be on that joint. Why? Because it is crossing the joint. Okay. If it is crossing one joint, it will be having action on one joint. If it crosses two joints, it will be having action on two joints. Okay. For instance, upper end crosses the hip joint, lower end crosses the knee joint. Then the muscle will have action on the hip joint as well as action on the knee joint. But if it crosses more than two, then it will have action on more than two joints. So looking that way, the biceps femoris is arising from the hip bone, the ischium. So it crosses the hip joint, isn't it? And is inserted below at the head of the fibula. So it crosses the knee joint. So it will have action on the hip. It will have action on the. So what will be the action on the knee? Flexion. So all these muscles cross the knee joint, and they will be producing which movement of the knee? Flexion. That's why this compartment is known as flexor compartment. Similarly, all the anteriorly located muscles will cross the knee anteriorly, and which action will be there? Extension. That's why the compartment is known as extensor compartment. Okay, but at the same time, since it's crossing hip joint, so it will also act on hip joint. And what will be the action on hip joint? Extension if it crosses behind, flexion if it crosses in front, like psoas major and iliacus. Right?
Right.
Very simple. Very simple.